Let's talk about Serbia, where local authorities in a number of cities have imposed states of emergency because of a rising number of COVID cases. The southern city of Novi Pazar is one of the epicentres of the new outbreak in Serbia, where many are saying the healthcare system is close to being overwhelmed. The name of that city has been the top Twitter trend in Serbia today. So let's talk to somebody who lives there. Let's say hello to Senad Koničanin, who's in the city of Novi Pazar, who owns a restaurant there, I understand. Senad, welcome.
Yeah, great. Great to get on your program.
And tell us about your experience of this, because I understand your mum is one of the people who has been poorly.
Yes. My mom got into the hospital a month ago, and she got there because of the common cold and some urinary problems, bacteria, and she caught the COVID19 in the hospital, and she was transported urgently to the city of Kragujevac, which is 120 kilometers away from our town, because our town was not equipped and still is not equipped with the proper materials and people they needed for COVID. Right now she's back home, she's doing great, but the problem is that 10 to 15 people are dying from our town and the town of Tutin and Sjenica, which is in the Sandžak region. They're all dying due to the lack of the equipment and the proper staff that we do not have at the hospital.
And do you know many other people, and by the way, great to hear your mum is doing better, but do you know many other people yourself who have had coronavirus and COVID-19?
There's not a family in Novi Pazar that does not have any of the members that has the symptoms, that is sick. But the biggest problem is that the hospital was crowded. As the Prime Minister and the President of Mr. Vučić says on the TV earlier today, that the Ministry of Health did not respond on time. And that not responding on time caused us to be crowded in the hospital. People are lying in the hallways, sitting on the chairs. 2 people are put in bed so they can get the IV antibiotics infusions. There was no central oxygen. They're still getting oxygens from the old pumps, like from the, I don't know what century. But luckily today, hopefully, because the new management came to the hospital, and hopefully I think things are getting better, because there's a lot of doctors coming from Bosnia, from Turkey, from all over Serbia, technicians, nurses, doctors, that this is what we need.
And you're talking there about President Vučić, and the Prime Minister and Health Minister was also in town yesterday. I know that people booed him, that nurses turned their backs, those 2 senior politicians yesterday. The President, though, also saying that in his opinion, the general hospital in your city is better equipped than any German hospital, a quote from the B92 website. What's your reaction to that? Because that sounds very different to the account you just gave me.
See, that is something that people do not like to hear. We are living here. We can see people dying outside in the corridors outside of the hospital. There's like 10 to 15 janazas or burials every day in our city, which used to have 1 or 2 burials during the day. In the last 10, 15 days, the pandemic has gotten so much people dying, maybe or probably over 100 people has died, and they're still saying 7 or 8 people have died from corona. But from the officials, from the religious institutions, from the Islamic and the Christian community that do the burial, we have confirmed that 25 people have been buried in the tin caskets. You know, tin that's must have been died of COVID. And the officials say 7 or 8 people. They're not quite sure how many people died, but we have it in our friends, in the neighboring and the family. We've got people are dying.
The implication,
that's the biggest problem.
I was going to say, the implication, you mentioned the religious communities in your city. It's a Muslim majority city, I understand. The implication in some of what the President and others have been saying is that he feels that people are using this as a political thing to drive communities apart. Do you agree with that, or do you think it's nothing to do with that at all?
It's got nothing to do with politics. People that were booing the Prime Minister and Minister of Health yesterday were people from the city that got their family dying. The biggest problem is actually that they say, we are crowded, we cannot help you, we cannot get transport you to Kragujevac or Belgrade, please go home. They give you a list of, on a small piece of paper, list of antibiotics and some vitamins that you can drink, and they say, if you feel that you're gonna die, actually, if you're so critical, please come to the hospital. You cannot do that. People are this is humane society. This is 21st century. And you cannot have people being treated home for COVID, you know.
And I was just going to say, Senad, in the last minute, in the situation that you described, for somebody who runs a restaurant, and a restaurant I understand where in normal times you host weddings. You can't be doing many of those at the moment while this emergency is going on around you.
No, we cannot do it because previously, for the first 2 months, we had state of emergency. We closed down the restaurant. We just opened working for 7 or 8 days. There was also a new pandemic in our city, so we got the state of emergency for our municipality of Tutin, and the restaurant got closed again. I really don't care about myself, but there's like 15, 20 families that work for me. They have to make their salaries and everything.
Well, hopefully things are going in the right direction if what you're telling me is true about the improvements that are coming. So I do wish you all the best, Senad, you and your family, and I'm glad your mum's doing better. So thanks for speaking to us.